it's a gross thing that you see the margins are undermined, but you can see that very, very well, even in a well-prepared histological specimen. Okay, now those were the major patterns, but we have lots of sub-patterns, okay, and we should know about some of them. Some of these sub-patterns are monomorphic, pleomorphic, polymorphous, polymorphic, multifocal, multicentric. These are all sub-patterns. The major pattern may be whatever it is. It may be sheet-like, it may be anything, but there are patterns that we also, when I'm looking at something, I have to make up in my mind what are the most important sub-pattern that I have to apply to whatever it is that I'm looking at. And certainly if you're doing tumor pathology, but it is not necessarily only tumor pathology, these are the 4 patterns that you should describe in your head. Is this epithelial or epithelioid? Is it mesenchymal? Is it multiphasic, bi or triphasic? Is it round cell stroke hematolymphoid? Okay, these are the patterns that you should become familiar with. Okay, how do I know that something is epithelial or epithelioid? I know this because there is cohesion between the cells. That's what makes an epithelium an epithelium. It is the cells cohere. They cling to one another, okay, because they have adhesion molecules, or whether it's ecadherin, or they also have like squamous epithelium, they have desmosomes, etc., that make them cohere. Okay, so all epithelia cohere to one another. Sometimes this is flat, and it is made up, when you look at an epithelioid pattern, the cells that make up that epithelioid pattern are usually cuboidal or columnar. Very, very seldom can they be spindle. It's very unusual to get a spindle cell forming an epithelial pattern, or a group of spindle cells forming an epithelial pattern. It very, very seldom happens. Okay, so that's epithelial or epithelioid. Then mesenchymal, that's where your spindle cells, play an important part. A mesenchymal pattern is when you have spindle cells or stellate cells in loose arrangements or tight arrangements, whatever, and there is matrix formation, and we'll see what are the patterns of spindle and stellate cells. Then, of course, bi and triphasic may be epithelioid plus mesenchymal plus maybe sometimes round, plus minus round cells, or maybe 2 different kinds of mesenchymal patterns, whatever. But that's more than one type of the patterns that I have stated over here in the middle box. And finally, round cell and hematolymphoid. They are small blue cells. Not all of them have either round cytoplasm or round nucleus. I do not like this term round cell because most of them are not round. Okay, they are small blue cells. Why do they look small and blue? Because they have they have very little cytoplasm. So they may be small oval blue cells. They may be, then the nuclei are oval or round because you can hardly see any cytoplasm. And they are prone to crushing. Why are they prone to crushing? Sudesh, can you tell me? Why do small blue cell tumors, whether they're lymphomas or there is neuroblastoma or it is embryonal rhabdomyosarcoma or any other small blue cell tumor, why are they prone to crushing? Yes, Sudesh? And anybody can reply in the chat box. Yeah, Shubhra? Huh? No? Jyoti? No? Because it has no cytoplasm, no? Yeah, suppose you have a cake, small cake in a little box, okay? And there is no box, or the box is very small and is not firm around it. That cake will crush, no? Yeah. So that's why you put cakes and other things into firm boxes that will not crush easily when it gets slightly indented. And it has space around it. Now, if you have no cytoplasm, which is essentially the box which protects the nucleus, that cell is going to crush, right? And the nucleus will get jammed. So just think of this. It is the cytoskeleton of a cell that protects the cell from trauma, from being destroyed by trauma. Now here you are. There's little or no cytoplasm. Lymphomas or lymphocytes have little or no cytoplasm. They don't have, little or no cytoskeleton. Say so also with neuroblastoma, so also with other things. So if you don't have cytoplasm, you don't have cytoskeleton, and therefore these things crush very easily. And that's a pattern that you recognize. You see crushing and you see these small blue cells, then you know that this is either lymphoid or neuroblastoma or Ewing's or some other tumor which has got very little cytoplasm. Okay, good. Now here, monomorphic versus pleomorphic. Good. There are no prizes for guessing, right? The one on the left is small blue cell monomorphic. Yeah, uniform, little variation in size, shape, cytoplasm of the nuclei. This is monomorphic. But you don't only get monomorphic tumors that are small and blue. You can get lots of monomorphic tumors, right? A hepatocellular carcinoma is monomorphic, isn't it? It looks the same. It's got all those big box-like things, and there is no variation. It's a well-differentiated hepatocellular carcinoma. That's it. Okay, so it's monomorphic in its appearance. It might have some other sub-patterns, like which we will discuss later, but it's for all practical purposes, cellular-wise, cytology-wise, it's monomorphic. On the other hand, here, you have pleomorphic. Now, most students use this word pleomorphic in a very, very loose kind of way. Just see what is pleomorphic. It is marked variation. You should use that term pleomorphic only if there is marked variation in size and shape of the cytoplasm and the nuclei. So saying there is moderate pleomorphism, saying that there is mild pleomorphism doesn't mean anything. Is it pleomorphic? Then it must have marked variation in size and shape. Okay, so using this word loosely is, to me, not the appropriate use of this word pleomorphism. Now, please remember that pleomorphic adenoma is not truly pleomorphic. It's not. Okay, it is something else. We call it pleomorphic because we're using this term not in the way that it was supposed to be used. It was used in, once upon a time, and the name has stuck. But that is not what true pleomorphism, as we as pathologists understand it. It is pleomorphic adenoma does not have marked variation in size and shape of the cytoplasm and the nuclei. What does pleomorphic adenoma have, Neha? Neha there? No. Jyoti? What does pleomorphic adenoma have that we call it pleomorphic? And it's not to be used in that context. Jyoti is also not. Are you there, Jyoti? No. Shubhra? What?
It is
that is
epithelial and stromal components.
So it should actually be called polymorphic or even polymorphous, because poly means what? Poly means many, right? Many different forms. Pleo means marked is variation in forms. So you have one form that is varying in different parts of that. Here there are multiple forms. So the real term should have been polymorphic, but for whatever reasons we call it pleomorphic. It's very different from the way that we use pleomorphic in when we have the tumor, like I showed you before. That is pleomorphic. Big, giant cells, intermediate size cells. You've got marked anisocytosis of the nuclei, also the shape of the nuclei, etc. Okay, so that is polymorphic, and what it means is multiple different patterns in tissues, and you know that, you get that. Yeah, you're seeing that there's cartilage, there's myxoid, there are ducts being formed, other types of other cell types which are myoepithelial cells. You can get cartilage, you can get bone, you can get hyaline. That is truly what polymorphic means. Okay, and you do get that in some other tumors, but I'm just showing you what polymorphic actually means. There is another word that we use, and that is polymorphous. And I'm showing you this. This happens to be a Hodgkin's lymphoma. And you can see that there are eosinophils. I don't know if the big cells are here, but there are eosinophils, there are lymphocytes, there are plasma cells. So there are many different types of cells. Okay, they may be in this case in a sheet. So there is one pattern. It's a sheet, but there are many different kinds of cells that are forming that sheet. Okay, so that is what we call polymorphous. It is use of the language. So that's why I'm telling you that you must learn the language that we speak so that you can speak to me and I will understand. I speak to you and you will understand. The textbooks say something and you should understand. Okay, so this is the difference between pleomorphic, polymorphic, and polymorphous. Has anybody got any questions about this in the chat box, Shrutika?
No, ma'am.
No, ma'am.
All right, good. We'll go to the next. Now there are some other sub-patterns. Okay, other sub-patterns. We're still describing all the sub-patterns. So now who's there? Pratibha, you're there?
Yes, ma'am.
Very good. Now here I have a pattern on the left. Tell me, what pattern would you call it? I told you, no, that we have 3 patterns. What are those 3 patterns when we are looking at something? 4 patterns, actually. I said that it is epithelioid. It is,
Mesenchymal,
yeah, mesenchymal, yes.
biphasic and triphasic,
Exactly. And there is
round cell and
round cell. Now, come on. We have only these four things. So now tell me, what is this first pattern?
epithelioid,
Epithelioid. Excellent. All right. Then what is the next pattern?
mesenchymal,
Mesenchymal. Why did you say it's mesenchymal? Are you guessing or do you know? Because in a minute I'm going to ask you why you call that epithelioid. All right. So what is this? Why is it mesenchymal? What?
there's connective tissue and
Because it's connective tissue. Because it's connective tissue. That if you call that mesenchymal because it's connective tissue, I'm sorry, Pratibha, you have not understood a single word. Yeah, come on, Shubhra.
Spindle cells, ma'am.
Because it has spindle cells and or stellate cells.
Loosely.
The mesenchymal patterns cannot be epithelioid. Mesenchymal tumors can be epithelioid, but a mesenchymal pattern can be is usually made up of mesenchymal tumors. That means tumors that are proliferating or scar tissue or anything that shows you spindle cells and shows you stellate cells can only show you a mesenchymal pattern. Now, if you have a tumor like a squamous carcinoma, which has become spindly, okay, what do we call a spindly squamous carcinoma, Pratibha? Let's ask Sudesh. When a squamous carcinoma or any carcinoma becomes spindly, what do we call it? Sudesh, you've done 8 months. Come on. We call it a sarcomatoid
Matoid.
carcinoma. Yes, that's what we call it. Bushra, have you heard the term? Did you hear the term, Bushra? No, I'm calling you Bushra. Shubra? Yes, have you heard the term? No, never heard the term sarcomatoid carcinoma?
Yes, ma'am, heard of it.
Then if you know that term, it's got spindle cells. So what is the pattern of a sarcomatoid carcinoma? What is the pattern? Come on, Pratibha. If you have a spindle cell squamous carcinoma, what is
Biphasic.
the pattern?
Biphasic.
Yeah?
It has to be biphasic because it's having.
Biphasic. I'm telling you that it is only spindly.
Okay.
Then what is the pattern? Yes, Sudesh? What is the pattern?
In the
of
second
sarcomatoid
second
squamous
picture, ma'am.
carcinoma? Yes?
In the second picture, ma'am.
No, I'm asking you if you had a
Fascicular
sarcomatoid
pattern, ma'am.
squamous carcinoma, what kind of pattern would you call it?
Fascicular pattern, ma'am.
Fascicular, really? I'm giving you three options. I'm giving you epithelioid, mesenchymal, and round cell. So which will you pick?
Mesenchymal.
Yeah, which one will you pick, Shubra?
Mesenchymal.
Mesenchymal. So mesenchymal doesn't mean a pattern, doesn't mean that the tumor or whatever you're looking at is mesenchymal. It is a pattern of growth, and that pattern of growth involves any lesion that has spindle or stellate cells. I want you to repeat that for me, please, Sudesh, so that everybody understands. What did I say now? Yeah, tell me.
It's about pattern, ma'am. Mesenchymal.
No, I want to know what a mesenchymal pattern is. Because I don't think either you or Jyoti or Pratibha or who else is there left, Anjana, actually understand. So I want you to explain it. Explain it. What is a mesenchymal pattern? Okay, Shubhra, you know?
It's
Please explain it. Yes, Shubhra, come on. I can sit here forever because you have to understand it. Because I know exactly what you guys are thinking. That epithelioid pattern means that this has to be an epithelial tumor. That a mesenchymal pattern means that it has to be a mesenchymal tumor. A round cell pattern means it can be a lot of round cell tumors. I know that's what you're thinking. Okay, so now please tell me, Shubhra, what does this mean? What is a mesenchymal pattern?
And my mesenchymal pattern can be seen in any three, means it can be seen even in epithelial cells and
Exactly.
even in
It's a
spindle cells.
pattern.
Yeah.
It's a pattern of growth which will be demonstrated by anything,
Yes.
whether it is a scar or it is a tumor or and that tumor can be of mesenchymal origin. It may be a sarcoma, or it can even be a carcinoma that is entirely spindly. That is what is the meaning. Has anybody ever seen an anaplastic carcinoma of the thyroid? Have you heard about it? Yeah. There is no normal epithelial thyroid component in that. It is all made up of spindle cells and pleomorphic cells. So that is a mesenchymal pattern. But the diagnosis is what? Anaplastic carcinoma of the thyroid. So once again, Anjana, you will explain to me what is the meaning of a mesenchymal pattern.
Mesenchymal pattern, it can happen in anything, ma'am. Like it can be not only the mesenchymal tumors. It can be seen in epithelioid, epithelial like cells or in
Can be
spindle
seen in
cells.
epithelioid what?
No, ma'am, in that epithelial, it's not like in a epithelial mesenchymal
But how do
tumors
I know
only.
it is a mesenchymal pattern? What
Like
defines a mesenchymal pattern, please, Anjana?
spindle cell, a spindle type of cell.
Spindle or stellate cells, okay? And it doesn't matter what the derivation of those
Derivation.
spindle or stellate cells is. Sudesh, will you please
ma'am.
tell me what you have understood?
Yes, ma'am. Mesenchymal pattern doesn't necessarily needs mesenchymal cells, ma'am. It can be present at any other site,
Yeah, but how do I recognize a mesenchymal pattern, please, Sudesh?
ma'am. If there is presence of spindle cell, ma'am.
There is the presence, it must have spindle
This
or
must have.
stellate cells. It's not that there may be something here or something there. It is made up of spindle cells, okay? Spindle or stellate cells form a mesenchymal pattern, and that mesenchymal pattern may be seen in any lesion. It can be tumorous, it can be scar, it can even be a carcinoma. Okay? Have you got that? Who? I only see 3 people over here. Who else is there? Is Jyoti there? Jyoti, are you there? Or Jyoti dropped off? I don't know. Shrutika, who's there now? Do I have? I have Sudesh. I have
Anjana,
Pratibha.
Sudesh,
Anjana is there, madam.
Anjana is there. Anjana, yes, I
Pratibha.
Anjana,
just told you.
Shubhra,
Anjana.
Pratibha.
Pratibha is also there.
So Pratibha, will you repeat now? What have you understood about mesenchymal pattern?
Ma'am, mesenchymal pattern is a growth pattern. It does not necessarily
Yes,
contain
a growth
mesenchymal
pattern
tissue.
composed of?
Stellate cells and spindle cells.
Absolutely. And I hope that having talked to all of you, that the audience understands this as well. Okay? That is what patterns are about. Patterns are not about cells, not about derivation. That what is the histogenesis of this lesion? Okay, a pattern is a pattern. Histogenesis is a completely different issue. And it's still not finished over here. So you're absolutely right. This is mesenchymal, it's infiltrative, and it happens to be a desmoid tumor. That's okay. This happens to be a mesenchymal thing. What is the next one, Pratibha? What is this last one on the right hand side? What would you want to call it?
Round cell.
Round cell. Excellent. I told you that I don't like the term round cell, so I call it small
Blue cell.
blue cell. Okay. Now, I don't know who called this epithelioid. Who was answering at that time? Was it you, Pratibha?
Um,
Did you say epithelioid or did who said
I
epithelioid?
said.
Sorry,
I
you
said
said? Excellent. So now you tell me, this is epithelioid. Okay, so what do you think the diagnosis could be over here? Pratibha?
Yes, ma'am.
Is it a tumor? It's a tumor, right?
Um,
Yeah. So do you expect this to be any particular kind of tumor? Don't tell me what the actual diagnosis is. Do you think it's a carcinoma? Do you think it is a sarcoma? Do you think it is a lymphoma? This is an epithelioid pattern. Yeah. So is
yes.
it a carcinoma? Is it a sarcoma? Is it a lymphoma? Think carefully. Anything? At least you know which it is not. Okay. Shubhra.
Ma'am, it can be anything because we can't comment on its histogenesis.
Yeah, Shubhra is absolutely right. You can get carcinomas, you can get lymphomas, you can get sarcomas that have an epithelioid appearance. So once again, please, Shubhra is right. It is a pattern. And that pattern has, in many cases, has got something to do with its derivation, but not in all cases. And you want to know what this tumor is? I'll tell you. It is a gastrointestinal stromal tumor, which is not either a lymphoma, nor is it a carcinoma. It is a stromal tumor. Okay, so it is a mesenchymal stromal tumor. It's an epithelial. I don't want the diagnosis. I just want you guys to understand that we are talking patterns and we are not talking derivation, histogenesis, and any kind of tumor can show you a pattern which normally it should not do. Okay, so normally carcinomas should all be epithelioid, but they can show you a mesenchymal pattern. Yeah, normally sarcomas should be spindly and stellate, but like this, it can show an epithelioid pattern. Ah, very good. And Sudesh, now tell me, what do you think of the last thing? What's the diagnosis over here? Sudesh.
Yes, ma'am.
Tell me the diagnosis of the small blue cell tumor. What do you think?
Gastrointestinal tumor, ma'am.
The small blue cell tumor is the gastrointestinal stromal tumor? No. The first one is, okay, this is a gastrointestinal stromal tumor. It had an
Last one
epithelioid appearance. Yes, the last one, Sudesh.
can
This,
be lymphoma, ma'am.
it could be lymphoma. Yes, it could be anything, but I'll tell you what it is. It's a small cell carcinoma. So, once again, something that can look like a lymphoma is actually a carcinoma. So, patterns do not tell you that this belongs to that particular category that the pattern represents. Have you understood that? I think I've made it abundantly clear that epithelioid doesn't mean that it has got epithelial derivation. It can be a sarcoma, it can even be a lymphoma. Mesenchymal doesn't mean, the pattern doesn't mean that it is of mesenchymal derivation. It is only composed of cells that are spindly or stellate. Here, in epithelioid is composed of cells that cohere or stick to one another, which means that this may be of mesenchymal origin, or it may even be of a lymphomatous type, but it is expressing this pattern of sticking together and forming, giving an impression that this is like an epithelium. Okay, so that's what we are talking about. It's all to do with adhesion molecules and so many things, but I don't think that I need to talk about that. If any of you have any questions about it, I can answer this later after we have finished, but please also send me an email. Now there are the sub patterns. Okay, and here you have epithelial and mesenchymal, which is biphasic. We have mesenchymal. All of this over here is mesenchymal and it is triphasic. You've got fat, you have got these pink collagen-like cells, which are fibroblastic cells, which are producing collagen. And then you have these myxoid areas where cells are producing a myxomatous matrix. There is no carcinoma, there's nothing. Here you have epithelium, and then you have mesenchymal. Okay, here you have, it's triphasic, and this is a tumor which is known as a fibrous hamartoma of infancy, but you don't need to know that. And here there is mesenchymal and epithelial biphasic. You see the epithelium here, you see the epithelium here, you see the epithelium here, you see epithelial cysts over here, and the rest of this is all looking spindly and stellate. So this is a mesenchymal pattern. Do you agree with me, all of you? Is that
Yes,
a mesenchymal pattern? Yes, but it is now combined with an epithelial pattern, and this is, you know what the diagnosis on the left-hand side is? It's a fibroadenoma. This is a fibrous hamartoma of infancy, and that is a carcinosarcoma. And let me tell you that in a carcinosarcoma, you will learn it as you go along, that the sarcoma is not a true sarcoma. It is a carcinoma that has become spindly. Okay, so that's what a carcinosarcoma is. Okay, now if we are talking about epithelial and epithelioid patterns, then we have to know that there are patterns with spaces and patterns without spaces. Okay, and I've shown you what are the patterns without spaces. Squamous pattern is without a space. You get stratifications and pseudo-stratifications, and then you get papillary, pseudo-papillary. You get cords and trabeculae and rows and nests and islands, morules, sheets. All of these can be epithelial or epithelioid, but they don't have spaces. On the other hand, look at the patterns with spaces. It can be glandular, it can be ductular, it can be tubular, there is acinar, there is alveolar, follicular, cribriform, adenoid, and comido. Look at the number of patterns that you get. And yet, we do not use words the way that they should be used. You see an epithelial structure and you see a space, everything is called a gland. No, it's not. Everything is not a gland. Okay? Do you have glands in the breast, Sudesh? Do you have glands in the breast?
Ducts.
Yes, you do. You do?
Yeah, ma'am.
Really? Which gland have you seen in the breast?
Ducts, ma'am.
There you are. Is the duct
Ducts.
a gland? I'm just telling
No.
you, ducts and glands are not the same
same,
thing.
ma'am.
Okay? Bushra, Shubhra, I keep calling you Bushra. Shubhra, do you
Yes.
have glands within the lobules of the salivary gland? The salivary gland is a gland, but do you have glands in the salivary gland?
No, we have
No.
ducts.
Well, there are ducts and acini in the salivary gland. There are only ducts in the breast. Okay? So please, you can't call ducts glands. They are not glands. And it's high time that you learned how to use words properly. Okay? So now, this is what you need to know. What is a gland? A gland is a secretory element, okay? And it secretes, it has got a wide area and it secretes something into it. It's not small and it's not terminal because there are other secretory apparatus. You know what a duct is. It's a conducting system. It doesn't secrete anything. It just conducts something. Then there is an acinus. Acinus is distal and secretory. So in the salivary gland, you have an acinus, right? And in that acinus, that secretes. If it's a mucus secreting salivary gland, then it secretes mucin. If it is a serous gland, it will secrete mucin. But you don't call it a gland. You call it an acinus because it is absolutely terminal and it is throwing stuff into the ducts that carry it away. Tubules are like a tube. It's usually a duct, but it can also have, glands can have a tubular structure. Okay? That's something that you have to realize. Alveole, here we are. Here is the salivary gland. You see the acini? They're the absolute end. Then, of course, you see some, there's an intercalated duct here, which I'm not interested in, but you can see the ducts. Okay, and they're quite different from one another. There are no glands in the salivary gland. The salivary gland is an organ. And in that organ, you have acini and ducts. Understood that? So you never talk about glandular structures in the salivary gland. There are no glands in the salivary gland. If you're describing tumors in the salivary gland, please describe spaces that you see as ducts. The same thing in the breast. Please do not describe structures that you see which have epithelial lining and maybe epithelial proliferations as glands. They are ducts that you see in the breast. Okay, but here you have, what is this this particular structure here, Pratibha?
In ma'am, skin.
This lower structure is skin, Pratibha.
Yes, ma'am.
Is that skin?
This
Pratibha,
epithelium.
this is skin. This Anjana, what is it?
Just intestine, ma'am.
Intestine.
Intestine, villi, ma'am.
It is the large intestine.
Intestine.
Okay, and the large intestine has got long tubular glands. Okay, they are secretory. What are they secreting? They are secreting mucus. Can you
Mucus.
see that? Yeah, the goblet cells, they are secreting mucus, and these are known as long tubular glands. So now all that tubular means that it is like a tube, and everybody talks about this as being like test tube like glands. No, that's how one describes these kind of things. Yeah, so it is a gland, but it is a tubular gland. A lot of tubules are just conducting, they're like ducts. Okay, so you can have ducts that are like tubules, and you can have glands that are like tubules. All right, now let's come to alveolus. What is an alveolus? You know that we have alveoli in the lung.
No.
They're non-secretory pouch-like structures. You know that an alveolus is an end structure that is like a pouch. Yes. Do you know why we call the alveolar mucosa the alveolar mucosa? Do you know what an alveolar mucosa is? Sudesh, what is an alveolar mucosa or an alveolar part of the alveolus of the mandible? You know that, Sudesh? No, Sudesh doesn't know. Yeah, come on, tell me, Shubhra. We've got no an alveolus in the
Yes, ma'am,
mandible.
it holds the tooth.
Because, yes, the part that has the teeth, exactly. So
Pocket,
why do
ma'am.
we call it the alveolus?
I mean, it's a
Yes, Sudesh?
pouch like.
Because
Yes,
there is
because
gap, ma'am.
tooth
Socket-like structure.
sockets are like pouches. So that's why it's called the alveolar process of the mandible, and that is alveolar mucosa on the alveolar, the gingiva where the teeth are. Okay, so that is what is alveolus. Follicle, what is follicle? How do you know that something is a follicle? Yeah, what is the thyroid has follicles, the ovary has follicles, there are follicles in the lymph node. So what is common between lymph node follicles, ovarian follicles, and thyroid follicles? Did you ever think what it could be? Anjana?
Ma'am,
Yeah, what is a follicle? How do you define a follicle? Then you'll know the follicular structure. You will know a pattern. So what is it? See, nobody has ever bothered to think. And you feel you'll come to a lecture and you will learn. No, you don't learn by listening at lectures. You learn by asking yourself why. Why was a lymphoid follicle? What is common between a lymphoid follicle, an ovarian follicle, and a thyroid follicle? And the commonality is a sphere. They're all spherical. Okay? So it is spherical and it is shut. It is closed. Okay? So it's not spherical with a little opening at one end. It is a closed spherical structure. And that closed spherical structure may be hollow or it may be solid. The lymphoid follicle is solid. The one in the ovary is got fluid in it. The one in the thyroid has got
Correct.
thyroid, thyroglobulin and thyroid hormones. It's got colloid in it, as you see over here. Okay, so that's a thyroid follicle that you are seeing. Cribriform, everybody should know. Okay, it's perforated like this. This is cribriform and adenoid. This is not a gland. Adenoid means gland-like. So come on, Sudesh, why is it not a true gland?
Because gland should secrete, ma'am. There must be secretion.
So then what is this stuff in what you're seeing here? It's not a secretion? Well, let me tell you, friends, that it is a secretion, but it is not a secretion into a lumen. Glands are secretory, they secrete into a lumen. This is not secreting into a lumen. In fact, you can clearly see over here that here is something that looks as if it is a lining, but look at it here. There is a lumen. Can you, all of you see? There is a slit-like lumen over there. There is also a lumen over here. There is a lumen over here. But this stuff is not in the lumen. It is in the stroma because myoepithelial cells also secrete. They secrete basement membrane. They secrete all of the things that you know that myoepithelial cells secrete. What do they secrete, Sudesh? Besides secreting basement membrane? You've seen it. You've seen it in a pleomorphic adenoma, chondroid, mixochondroid, myxoid. All of that is the secretion of myoepithelial cells, and it is secreted into the stroma. So if it is being secreted into the stroma, there is no glandular lumen. Okay, these things are secreted into the stroma, a ball of secretion forms, and all these myoepithelial cells are surrounding them. And you can see that very, very well in this particular picture. That's why it is gland-like, it is not a true gland, because there is a secretion, but the secretion is what, Sudesh? Where is that secretion?
Stromal.
It is in the stroma. It goes into the stroma. Okay. And that is what gives you these cylinders. Okay. So really it is a cylinder in which secretion is in the stroma, and there is no true gland or true lumen into which the abluminal cells will secrete, or the luminal cells will secrete. You just need to know or recognize these patterns, and slowly you will understand why they are. And here you are. This is an FNAC of an adenoid cystic carcinoma, and you see these are myoepithelial cells, and they are this very purpley magenta colored material, and you see the myoepithelial cells are sticking to it, and there are no glands at all. So there is no glandular thing. This is adenoid, and you see it very beautifully when you actually do an FNAC of this. Now, there are epithelial structures and epithelioid structures without spaces, and you know that squamous is a single or layered structure with flat cells in a pavement. That is what is the meaning of squamous, pavemented. Okay, and there you are. That is what, and there are no spaces here. Then you have keratin that comes up, and here this is squamous. You can actually see all those tiny little desmosomes between the cells, but here it is not producing any keratin, and therefore it is often called epidermoid, because it doesn't look like skin, because skin always shows you keratinization. Okay, so that's the meaning of epidermoid. No keratin being produced at all. If there is keratin, then you use the word squamous. Okay, here we are. Somebody was asking about papillary. What is a papilla or a villus? Both have more or less the same definition. Narrow processes projecting into a space or above a lining. Okay, it can be projecting above a lining, or it can project into a space. It should have a core in the center. A villus has a core. Here is the villus. This is the normal villi of the small intestine. They have a core of tissue, and there is an epithelium that is on the surface of that core. So this is papillary carcinoma of the thyroid. This is a villus adenoma of the colon, and you can see how similar these look. Now you might turn around and ask me, why don't we call this a villus? Yeah, you can if you want to, but there is, a villus, if you look at it, doesn't branch as a rule. Okay, even in a villus adenoma, you'll see them going as little long tubular finger-like processes right from the bottom. Some villus adenomas may show you branching, but very, very seldom do they branch. But look at papillae. Papillae do branch. So we have to be also use terms a little bit appropriately. So it's not just finger-like processes. The finger-like processes have different names when they look differently. You see branching all the time in papillae. You don't normally see that in villi. Okay. Now here is another epithelioid structure. You know it's epithelioid. Why is it epithelioid, Sudesh? Why is it epithelioid? What is the main main characteristic of something that we call epithelial or epithelioid?
There should be lining, ma'am. Cohesion of the cell, ma'am. The cells must
It
be
doesn't have to be a lining, please. It has to be cohesion of cells.
cohesive, ma'am.
Yes, cohesion. Cohesion is what makes something epithelioid. Please remember this, okay? It is cohesion. All epithelia cohere, no? Whether it's a squamous epithelium or it is the epithelium of the gut or whatever, they all cohere together, okay? Which mesenchymal, normal mesenchymal tissues do not do. Fibroblasts don't stick to one another, okay? So, this is, so you know it is epithelial because yes, they are all sticking to one another. But is this papillary, Sudesh? Is it papillary?
No, ma'am. It's not
No,
like
ma'am.
that.
Excellent. Pratibha, is
No,
it
ma'am.
papillary? What do you think these are? Do you think these are cores in the center and around them are these epithelioid areas? Huh, Shubhra?
Yes, ma'am.
You think it's papillary. Very good. What about
Yes.
Anjana?
Ma'am, the fibrovascular core is there. It's
There is a
papillary.
fibrovascular core. Yeah, it looks like a fibrovascular core. So what
Papillary, I
is
think,
it?
ma'am.
Is it papillary?
I think so, ma'am. Papillary.
Okay, so I've got 2 against 2 over here. So I have to be the arbiter. Okay. What did we say about fibrovascular cores or anything else for papillae? You want to go and look at the definition? What is it?
If there is absence of
Read
fibrobascular
it
core, ma'am,
loudly, please. Who are the 2 people who said it was papillary? Shubhra, read it loudly. What is a papillary or villus structure? Loudly, come on.
Narrow processes projecting into a space or above a lining with a surface lining and a stromal core in the center.
Correct. I'm sorry, that says stonal. I must have been sleepy last night. Okay. So now you know this definition. It's in your heads. Everybody is now. Please tell me, does it apply here? Does it apply here, Shubhra?
No, ma'am. These are
No.
not
Why
narrow
doesn't it apply?
cores.
Narrow process.
Oh,
These
it's
are
got
both
nothing to do whether it's narrow or broad. So
fibrovascular.
there is no fibrobascular core.
fibrovascular, it is there. But is it projecting into the space?
It's not projecting
No.
into the
Is it above a
space.
surface? Anjana? No,
Ma'am,
it is not. So what do you have? You have something that looks like a fibrovascular core. It looks as if there is a space around it. Yeah, but what is that space actually? Can you see how the spaces are being formed? How are they being formed? By the cells separating from one another, no? And then you look close by and you see the same fibrovascular cores are here in the stroma. So what does it mean? That this is a solid
Pseudopapillary.
tumor which is showing you dissociation of the cells from one another, forming spaces, and therefore producing what is called a pseudo-papillary appearance. We saw that in the pseudocystic, and now we have a pseudo-papillary appearance. Okay, so that's pseudo-papillary, and what we saw before was pseudocystic. And the mechanism of pseudocystic and pseudopapillary appearances is the same. You get either edema or the falling apart of cells from one another, getting detached from one another, and you get this kind of pseudo-papillary appearance. Okay, now there are some more epithelioid patterns without spaces. What would you call this pattern now, Anjana, on the left?
ma'am, lubrication.
Sorry, what are you calling it?
Lubrication.
Cribriform on the left. This one is cribriform. You know what was cribriform, Anjana? What did we say that cribriform was? Huh?
Ma'am,
Yes, Anjana, what is cribriform?
sieve like, ma'am.
What? Sieve-like. You know what
Lubriform
a
is
sieve?
sieve like.
It is perforated. It looks as if there are holes. It's perforated. Come on, Anjana. Does this look like it's got holes? This looks like it's got holes. Do you see holes over here, Anjana? Can you hear me, Anjana? Or you can't hear me. All right, Anjana has gone off. Shubhra, what pattern do you think this is?
This is a nested or modular.
Nested? Do you really think it's nested? You want to see nested? Don't you think it's here?
Yes, and this is nested.
The second thing shows nests. So what is this?
Trabecular.
Trabeculae? I don't think so. Pratibha, what do you think?
A modular pattern.
Modular? No. This one? They're sheets. These are sheets through which the stroma that has got lymphocytes in the stroma are just dissecting through it. So it's sheets in which you have got some lymphocytes in the stroma going through. So that is sheets. What do you see over here, Shubhra?
Nested, ma'am.
Yeah, so there are nests and there are islands. Okay? Smaller things are nests, the larger ones are islands. Somebody's thing is causing an echo. Now, what do you call this pattern? Here on the right hand side, Sudesh? All right. That's a sheet. And I told you a sheet is a patternless arrangement. The cells are in no pattern at all. It's the stroma that is causing a dissection through this. The second one is nest or island. Small or medium-sized groups of cells, all of the same type, separated from each other by distinct boundaries. You can see that, yeah. And as Dr. Dasgupta told you, it looks like a bird's nest. We are seeing something in 2 dimensions, and we have to build a 3-dimensional structure. An island is nothing but a larger nest. Okay, nest and island. And what is this? This is a module. Somebody said module. The module, these cannot be modules, because what is a module? A module is a nest of cells, often not always, arranged in a concentric fashion amidst differently patterned cell groups. Okay, so that it has to be different from whatever is around it. So that is what is a module. Now, Pratibha, can you see what is a module? Is very different from what is a nest
Around.
or an island. All right. Now here you have some other patterns. What is that? This is a row or a chord. Cells are usually cuboidal and arranged in a single row. What's the next one? It's a trabeculum. And as it was explained to you, this is a beam. You know, the beam in your house. And that's how it is. It's a thicker thing, which has more rows than a single row that is called a chord or a row. And here you see that there is nothing but a sinusoidal stroma. So you have these groups of cells, nests of cells with a sinusoidal stroma, only sinusoidal stroma, and that's called, very loosely called, an organoid pattern. Okay, so nests or trabeculae with nothing but a sinusoidal stroma is referred to as an organoid pattern. All right, we'll see some mesenchymal patterns now. All of these have got spindle cells in them. Okay, you can have other mesenchymal patterns which are haphazard or rosette-like, which have cells other than spindle cells, like stellate cells. Okay, stellate cells will be there in haphazard patterns, not in rosettes. They can be in cells that have in areas where there is myxochondroid, bone, cartilaginous tissue, etc. But when you have spindle cells alone, you can get one or other of these patterns. And here we have 3 patterns that I'm showing you. Pratibha, what is the first pattern? First is left-hand side. Okay, we're not reading Urdu.
Cells.
Yes, tell me. Or Chinese. You read from the top. So what is this pattern? And don't tell me spindle cell, because I know they're spindle cells. So what is the pattern?
Fascicles, fascicular
Fascicle.
pattern.
Excellent. Why have you called it a fascicle?
Because the cells is these spindle cells are there and they are present in bunches.
Yes, there is a bundle of spindle cells. Okay. That's all. That makes it a fascicle. I can see spindle cells in the next, and I can see spindle cells in the third. So then all of these are fascicles? And they're all in bundles. So what is it, Pratima? Why did you call it a fascicle? And if you don't know why, it is because you guessed. Okay? So yes, Sanjana, why is it a fascicle? She's right. It is a fascicle. Why? Do you have any idea? No, I can't hear her. She's making some. Yes, Shubhra?
And these are bundles of spindle cells and these are arranged perpendicular to each other. The bundles are
Perpendicular. Perpendicular. Where is anything perpendicular?
Yeah, ma'am, we can see these horizontal sections as well as vertically cut.
Oh, so that means that they are perpendicular to one another? No, I don't think so at all. Sudesh?
Yes, ma'am.
Yeah, why
Because
is
the
this a fascicle?
nucleus are running parallel to each other.
Yes, the cells are running parallel to each other, but they are also parallel to the direction in which that whole bundle is placed. That's why it is a fascicle. All right, look at this. This is the direction. These are how these cells are placed. They're all parallel to one another. And this is the direction in which that bundle is running. So you are seeing cells in the longitudinal direction of the cells is exactly parallel each to the other and to the direction in which that bundle is running. Okay, so you can have crisscross bundles. Okay, I have one fascicle running like this, I can have another fascicle running that way, but each of them is a fascicle. Okay, all right, very good. So that is a fascicle. What's the next thing?
Herringbone.
Pattern.
Sorry?
Herringbone.
Pattern.
Herringbone. Yes, it's called herringbone. Why? Because it's got, looks like the herringbone. You can see over here. Can you see? Or a feather. You can, if you don't like to think of herringbones and so forth, just think of it. It's like a feather, no? Where you have a rib that goes through the center, and then all of these are arranged obliquely to the direction in which that is. And what do you think this third one is?
Palisading.
From pattern.
It's not story form.
Palisading, ma'am.
Shubhra is absolutely right. It is a palisade. Look at these. These are nuclei are parallel to one another. Can you see them?
Yes, ma'am.
But they are perpendicular to the direction in which that bundle is running. See, this is the direction. Do you agree? This is the direction in which the bundle is running. Yeah, it's not running like this. It's running like this. And you have all these being, that's herringbone. You see this? This is the direction in which that bundle is running, and all these nuclei, and therefore the cells themselves, are perpendicular to the direction in which that bundle is running. And this is what we call a palisade. But it is not necessarily only a spindle cell pattern. Can you think of any other structure which forms a palisade? It just means that you must have elongated cells. Anyone, Sudesh?
Nuclei
In
in
the chat box?
basal cell carcinoma.
No.
Schwannoma.
Yes, basal cell carcinoma is the basal cells, yes?
Schwannoma.
Schwannoma, this is a
Schwannoma.
schwannoma, my dear. This
No, ma'am.
is a
In
schwannoma.
palisading appearance is in.
Yeah,
In
but this is a
papillary
schwannoma
carcinoma, we
I'm
see
showing it to you.
palisading of nucleus.
Sorry, yes?
In papillary
Any
carcinoma,
mucus secreting, Ari Baba, you see, no, in mucin secreting epithelium, you get tall columnar cells, all one next to the other, to then the other perpendicular
Yes.
to the basement membrane. So Sudesh is right. Yes, you get it in the basal layer cells, but you get it in all columnar epithelium, no? Because you get the basement membrane and all the cells are tall. So That is also a palisade. Okay? But this, I'm talking about a spindle cell palisade. Oh, 1 minute. Okay. Now here are the other patterns. Come on, what's the first pattern, Sudesh?
Gyriform.
Sorry, what? What pattern?
Ribbon-like.
It's not ribbon-like. This is the hemangiopericytomatous
Pericytomatous.
pattern.
Stagon.
You saw it
Stagon.
Tuesday.
Stagon pattern.
Stag horn. That's a stag.
Mm.
So you know what really worries me is that you sit, you listen to these lectures, and then you don't. I'm not asking you to remember this, but you have to know why it is called the way that is called. Somebody said story form. This is story form. You see this cartwheel-like appearance. There is a central area from
Rigidity.
which all of these things move out. That is staghorn vasculature. See this?
Mhm.
That's exactly how it looks. Okay, that is story form. And this has no pattern at all. It's haphazard. Okay, completely haphazard. You can't find, fascicles. It's not story form. It's not hemangiopericytomatous. It is got no real pattern. And this is very typical of stellate cells that you see in myofibroblasts. The pattern is usually haphazard. Okay, now what is this pattern? Shubhra, you said, no, see fascicles, and they're cut in different, so this is also a fascicle, and it's swirling around, and you have, this is a fascicle, these are fascicles, and you see them, some of them are just running around other fascicles. This is what is called a sheaf-like pattern. This is how, if you have a sheaf, okay, and then you cut this in across, you'll see this kind of pattern. So this is what you call a sheaf. And you see many of these in neural tumors. You don't really see them in other kinds of tumors. Some other tumors show it. Fascicles can be seen in so many spindle cell tumors, smooth muscle tumors, etc. But this is very often seen in neural tumors. Now here is another common pattern that you see in neural tumors. This is
Bag of worm.
bag of worms. Okay, yes. What is that? The
Plexiform.
name?
Plexiform.
Plexiform. Yes. And why is it called plexiform? See, it's a plexus. No, a plexus is a ramifying leash. Leash is, it's made up of long cables. Okay, so you know that nerves are cables, and you can have a leash of nerve fibers. When the nerve fibers are coming out of the foramina, etc. So it's a ramifying leash of elongated bundles of cells, or maybe even tubular structures. If you've got lots of tubes that are together and they form this, they are twisted over each other. They are known, even vessels, they're tubes. You can get a plexiform pattern even in vessels where you have lots. It's in, when you have these malformations, you get a plexiform malformation in people who have vascular malformations. So it can be spindle cells, it can be vessels, it can be anything, but this is a plexiform pattern. And I've shown you a cable on top, which you can see. Now we come to rosettes, true and false. There are lots of patterns. You know what this pattern is? You see that all small blue cells, by and large, rosettes are formed from small blue cells. So they're small blue cells, and the cytoplasm of the cell is merging or going towards the middle of the cell. And that is a homorite rosette called a true rosette. Okay, somebody gave them these names, true rosette. And here is Homer Wright. Hugo Homer Wright was the head of department of the Mass General when it first started. Okay. Here is another kind of small thing which has got a rosette is a small rose, and I've shown you a rose at the. That's whenever you use this suffix ette, you mean small. So we either use yule or we use et. You know, we said lobe, lobule. We are saying rose, rosette. So this is a small rose. And you see that this, unlike this, has got a lumen in the center and has a limiting membrane. Now this is a typical what we call Flexner Wintersteiner rosette, and it is also said to be true. By the way, Wintersteiner was an ophthalmologist. Simon Flexner was a pathologist, and this ophthalmologist, Wintersteiner, likened this, and he agreed with Flexner. He says, those look like the rods and cones. No, I don't think it looks like rods and cones, but whatever. Now here are appendible rosettes. Okay, they are small rosettes, look a lot like the Homer Wright rosettes, but they do not have that, that cytoplasmic processes that are in the center, also called true rosettes. Over here, you see there is a vessel, and then these appendible cells, the nuclei go towards the periphery, and the cell cytoplasm sits on the vascular basement membrane. Now, these are also appendible rosettes. There are true appendible rosettes as well in this particular tumor, but the perivascular rosettes are said to be false rosettes. In a minute, I'll tell you. This is all tradition. It's got nothing about true and false. Somebody called them true and false, and I'll tell you what the trueness about that. You notice true, true, true. And except for one that is in the CNS, it's false. So all the true rosettes are what are called neuro rosettes. Okay? But what will you say about this? Now, this also looks like a little rose. Some of them have a little space in the center, and this is not in the CNS. Okay? This is a neuroendocrine tumor. These are epithelial cells. So now what? Are you going to say that these are not true little rosettes? Are you going to say that epithelial cells cannot form a true rosette? Well, I don't know. I think that this is just tradition. I don't like to talk about true rosettes or false rosettes. Just name the rosettes according to, whatever you want to call it. Perivascular rosette, Homer Wright rosette, Flexner Wintersteiner rosette, appendible rosette, and you call this a neuroendocrine tumor rosette. Okay, now if anybody wants to know something about rosettes, go and look up this thing that I have shown you at the top. Okay, that's a very nice article on rosettes where they discuss what is true and what is false. If you're interested in it, go and read it. But according to me, just name the rosette for the way that we know it, and don't bother about what is true or false unless you're appearing for an exam and your examiner asks you about true and false rosettes. So then please remember them according to this categorization. And now we come to matrices. That means what's in the stroma. This is collagen, right? This is myxoid. You can see that it's blue-gray in color. It is produced by the cells of this particular tumor. It is secreted by the cells of this tumor, but it is in the stroma. Okay, remember that. It's not only epithelial cells that can secrete, mesenchymal cells can secrete, myoepithelial cells can secrete. Okay, so what is this matrix on the left-hand side? Again, anybody? Sudesh, what's that matrix that you see on the left-hand side? You know what is a matrix? What is the meaning of a matrix, Sudesh? That's another term that you need to learn. So what is matrix? Huh? Shubhra, what is a matrix? What is matrix? No, you never asked me, madam. I didn't understand what is a matrix. The plural of matrix is matrices. Yeah, Anjana, what is a matrix?
Stroma.
No, it is a cellular component of stroma. That is what is a matrix, an acellular component of the stroma. Okay, so do you see an acellular component here of the stroma or not, Sudesh? You certainly
Yes, ma'am.
saw collagen here. You saw myxoid here, which is acellular, and it is being produced by these cells. What is the acellular component over here? Okay, tell me what's it on the right side. What is the acellular component?
Myxoid.
Anybody, what is it? There is osteoid. Oh, there is this pink stuff which is osteoid and it is calcifying. And there is, see the amount of pink stuff that is present in the stroma. So this is myxoid. Can you see that? All the blue stuff as well as collagen. This one is collagen and calcifying osteoid. Okay, so here is the osteoid. This is the calcifying collagen. Okay. Here you have cartilage and osteoid on the left-hand side. This is osteoid. This is bone. Now, I cannot tell you all about this. There's somebody who's got a nice little doggy over there. Right. Here you have chondromyxin, which you already saw. Okay, I don't know who that is. Maybe Shrutika or Nisha's little one. Okay. Now,
No, ma'am, it's someone from the audience.
somebody from the audience. Okay. The language that pathologists speak. Okay. Recognizing patterns. All right. Now, come on. Now I'm not going to, you have to recognize these patterns. Come on. What patterns do you recognize here? This is the same tumor. What would you say? You have to describe this. What is the point of learning names and not being able to describe? Come on. In the end, you and the four of us will be the only people over here. Everybody will have gone off to have their dinner. What do you see?
Encapsulated solid
Solid.
Very good. Yes. Shubhra.
tumor.
Encapsulated, solid.
Solid tumor.
Anything else? Do you see something here? No? You don't see papillary?
Yes, ma'am.
So encapsulated, solid,
Solid
papillary,
papillary.
and you see
Papillary.
something other very interesting. Yes, it looks encapsulated, but look at it here. What happened here? There was a capsule. There was a capsule here, and this tumor broke through the capsule, and another capsule formed. So you can see it so beautifully. There is a tumor that is infiltrating this capsule, and you can see how it is infiltrated through this original capsule, and now a new capsule has formed. See how beautifully you can see these patterns. It's encapsulated, it's solid, papillary tumor showing multiple previous breaches and reconstitutions of its capsule. See, isn't this wonderful? These cells and the tissues talk to you. They're telling you what has gone on in those tissues. Okay, now identify these patterns. Pratibha, are you there?
Yes, ma'am.
She's gone? All right. Come on, Sudesh. Oh, there's
Cords,
Pratibha.
ma'am.
Yes, Pratibha.
Looks like
Tell me,
cord.
what is this pattern? Yes,
Cords.
anybody? Cords.
Cords,
Sudesh,
ma'am.
very good. There are cords here. What is this?
Trabeculae.
I can see cords. I can see
Cords and trabeculae.
Trabeculae, ma'am.
trabeculae. There are cords. There are nests, and there are
Nested.
tendons. Okay, you can see that. And here, what do you see? Small tubules, right?
Tubules.
When I don't know whether something is a gland or a duct, then it is safer to use the word tube or
Tubule.
tubules. Okay, so I don't know whether this is secretory or not, so I call it tubules. So it's an infiltrative tumor composed of islands, cords. I've said glands, it could be tubules, of monotonous cells in a collagenized and vascularized tumor. I know that it is infiltrative because you can see smooth muscle here where it is. Yeah, so this is a neuroendocrine tumor. That's not. Now, what about this? This is a breast tumor. What do you think is a pattern over here?
Antler horn pattern.
Antler horn, yes, pattern. But do you think that we'd call this hemangiopericytomatous? No, because hemangiopericytomatous we use for vascular. Yes, it has to be vascular. Yes, this looks like an antler horn. Actually, it is a large duct that is branching. It's branching so much, okay, that you see that the stroma seems to project into this, giving it
Pseudopapillary.
a pseudopapillary pattern. Absolutely right. And this is a Phyllodes tumor of the breast. So there is a Phyllodes tumor is a pseudopapillary tumor when you see it like this. Excellent. Very good. What about this? This is an ovarian tumor. Very good. What is this? What do you think? Here is the epithelium. Yeah, and this is high power. This is the low power.
Polypoid.
This
And it is projecting into something, right? It's projecting into a space. And it looks like it should be papillary, except that we usually call something that's thin and slender like a papilla. Okay, so if somebody wants to call this a broad-based papilla or something that has got broad stroma, fine. Okay, but you see that what is proliferating is not the stroma, it is actually the epithelium. And the epithelium is growing and dragging this stroma along with it. And this is a benign ovarian tumor. We see a lot of it all of the time, which is known as a cyst because it is growing adeno because there is a proliferation of the epithelium. We call it a fibro, okay, because those papillary structures, they look like they're very broad based papillae. We don't want to call it papillary over here, so we call it a cyst adenofibroma because the papillae we would like to think of as thin, slender thing. So this is a cyst adenofibroma. See, here is the another ovarian tumor, which is papillary. See these beautiful papillae. Here there is another broad thing which looks a lot like here the papillae are all fusing together. So here there is a cyst. It's a papillary cyst adenoma. Okay, so this is what you would call this. There are papillae, there's a cystic structure into which these papillae are growing. It is a papillary cyst adenoma. Now there is a soft tissue tumor here. Yeah, will you identify the pattern? What will you say? Shubhra always identifies this pattern very well. What is this? Capsule, right? Good. So it is encapsulated, solid, and it's in cords, right? You can see cords, and it has a myxoid stroma. So there is a myxoid stroma. The tumor is in cords, and it is in the soft tissues. So how will you do? Encapsulated. There's also collagenization and myxoid tumor growing in cords with ossification of its capsule. And this just happens to be the description of an ossifying fibromyxoid tumor. See, the whole thing is there in its description. Fibromyxoid. It's often encapsulated, or it seems to have a capsule, and it's ossifying. I tell you that if you do your observations well, you can even come to the diagnosis. What is this pattern on the left? This is the ovary. What is it? What's this pattern? Anjana. Anjana's left. Pratibha. What would you call this pattern? So there's
follicle.
Yes, it's a follicle. It's a cystic follicle. It's spherical. It's there in the ovary. If you didn't know it was in the ovary, maybe you would just call it a cyst. And this is the DNC of the same patient. Okay. This has a What pattern is this? This is endometrium. So those are glands. Okay. In the endometrium, you don't have ducts. In the endometrium, you have
Glands.
because they are secretory.
Secretary.
Ah, yes. So follicular and cystic, and this one is
Glandular.
Glandular.
Excellent. Now, what are these? So everybody was saying trabecules to trabeculae. Here are trabeculae of bone. Okay, so they are like beams. They may be like walls. So you beam or a wall. Here's another trabecular pattern on the
Trabecular.
right-hand side. This is a trabecular pattern. Trabeculae can be epithelioid. It can be mesenchymal. No, this is bone. What is this pattern?
Fish cheese, man.
Sheets. This is just sheets, right?
Seeds.
It is a monotonous
Or
sheet.
seeds.
Yes, very good. You know, it's a sheet. Now, what is this pattern? You've seen it before.
Ulcer.
Ulcerative.
Ulcerative.
Yes, this is an ulcerated with overhanging or undermined edges.
Edges.
There you are. You see that? Now it is undermined. So ulcer with slough in the floor and an undermined edge. All right, this is a very hemorrhagic lesion sitting in the scalp. This is the tumor. But I don't care whether you know what the tumor is. What is this pattern? What is this pattern? What do you see in the center over here?
Blood vessel.
There's a blood vessel. There's a blood vessel. There's a blood vessel. And then what do you see around it? Pseudo rosette.
Rosette.
Whatever they call it. Perivascular pseudo rosette. So there you are. It's an angiosarcoma with perivascular. It just shows better when you do a stain for the cell, and that is the endothelial cells, which is ERG. Okay. So now at the end of it all, when you're very tired, why do we need to recognize patterns? Do you think we need to recognize patterns? So
Yes,
tell
ma'am.
me. Why?
Yes, ma'am.
Why?
Because it helps, because different disease pathologies have different kinds of pattern, and it helps us to differentiate between them.
Excellent. What do you think, Shubhra? He's given us one good reason. Anything else? Why? He says that it helps us to make a diagnosis because different diseases and tumors and all have different patterns. Okay. Number one is to learn the language of pathology. Okay. To understand and be understood. If you don't know the language, it doesn't make any difference. Okay. How are you even going to know what pattern there is? Okay. Oh, sorry. 1 second. You have to learn these patterns to make good observations and interpretations because you know why? You trigger thoughts. See, I've got some patterns over here. Okay, Sudesh, what pattern is this? You've seen it before. Here,
Yes,
to
ma'am.
the right.
Comedo, ma'am.
Comedo. The moment you say comedo and you say that it's a carcinoma, you know that you're dealing with a breast carcinoma.
Breast carcinoma.
Here, Shubhra, what is this? This is squamous epithelium. All right. And what has happened to the squamous epithelium? There is a vesicle. Can you see that the squamous epithelium has been parted? And what we call it is a suprabasilar because it's basilar vesicle. Okay. So if there is a suprabasilar vesicle, the moment you say this word, it triggers a thought. And what is that thought? Pemphigus. See? So but to recognize it, you must know that this is a suprabasal. So you have to recognize that to trigger your thoughts. Okay. Here you have on the right-hand side bottom. What do you see? That was what, sort of Sudesh was talking about. You see this palisading? Basal palisading. And you have a basiloid tumor, and it is in the jaw, which shows a stellate reticulum. I'm giving you the pattern. What is it? It's an ameloblastoma. No, that's the only thing. You say this basal palisading, stellate reticulum, and it's in the jaw. It is an ameloblastoma. And what about this? What is this? This is normal cervix, and this is a biopsy from the cervix. So what is this? What pattern is this? This is squamous with normal polarity. Yeah, this is squamous with
Loss of
loss
polarity.
of polarity. You say loss of polarity, and you know what polarity is, which means the polarity means that you should have a normal
Nuclear.
pattern where you see this palisaded pattern at the bottom, which is basal cells, and then slowly the cells start to become parallel to the basement membrane, while these are, now see this over here, this is complete loss of polarity. You should have cells that are parallel, and what are you getting? These cells that are all perpendicular and all haphazardly placed. So the normal polarity has been lost, and that's why we call this loss of polarity. So when you say that, you know that there is dysplasia in this tissue. So the thought that there is dysplasia comes from this one phrase that we use, loss of polarity. That's also a pattern, by the way. And then, of course, what Sudesh said, it helps you to make a good diagnosis. It helps you to understand pathophysiology and pathogenesis. And as Sudesh said, the behavior of the lesion. If it's very pleomorphic and it's full of mitoses, it's going to behave in a very malignant fashion. Right? If something, the polarity is maintained up to a point, etc. So it's not a high-grade carcinoma in situ. Okay, so that's one. So what I will tell you in my last slide is good luck with your language classes. You have to learn the language that we as pathologists speak. And this is not the only 2 lectures that you have to, you say, I went to language class and I know. You have to use what you have heard from Dr. Dasgupta and myself. You have to put it into practice. Whenever you see something, please try to use the appropriate term for whatever it is, gross, microscopic, pattern, cell, whatever, okay? You learn from language speakers who use it appropriately and who will help you to use it. So, okay, you have to, if you're learning any other language, you learn it best if you learn it from people who are proficient, in the language. You learn a language by reading and using it in everyday life. You cannot suddenly one day become proficient in a language if you are not using it, okay? And I would say to become a Pandit, and you all have to become Pandits at some stage, you will have to have passion. Because without passion, if you're just bored, I'll do something, I'm sorry, you should just forget about becoming proficient in your class, okay? So I think with that, I have finished. Let me just escape, stop my sharing. Yeah, okay. And that is my little talk on the language that we pathologists speak. I don't think that there are any questions in the chat box. So
We don't have questions, ma'am, but we still have 100-strong audience.
all right, are there any questions?
No
No,
question.
no
Fair enough.
questions. A lot of thank yous, though.
Yeah, of course. That's but I have to thank all of you. I have to thank the 2 of you who probably also had their meals while I I was talking.
No, I
So
was too
please,
tempted to answer, but it was excellent session. Thank you so much.
Thank you, ma'am. Thank
not
you
at
very
all.
much.
Thank
Students
you,
had to leave
Sudesh
because
and Pratibha
they have library
and,
timings.
every one of them, Shubhra, and those who lasted out till the end, Anjana and Jyoti and Neha. I don't know. I think we lost some of them along the way. They had problems with their.
Some of them had to go on their calls, and then some have library
I
time
agree.
to
I
leave by
agree.
9:30, 10.
And
Yes.
so now you have the next talk, which will be on how to describe blood cells, and you must go there because again, hematology has a different language. Okay, so we talk about the language that pathologists speak, but what I have told you about and what Dr. Dasgupta did the last time pertains mainly to anatomic pathology. There is a whole new world in hematology. Okay, so And you have a very good teacher, and Jasmita Das is good. I've heard her many times. So please make it a point to do, because to me, these are the basic things that you have to learn. And you might think that, I don't need to, because I already have done this and I know how to make a diagnosis of this or that or the other. If you don't know these basic things, making a diagnosis of stuff that is easy. But when you need to go a little beyond that, then you have to be good at your observations, your interpretations. And for that, you need to trigger your thoughts by knowing the language that you should be able to speak. Okay? Thank you so much, all of you.
Thank you, ma'am.
Thank you so much, ma'am.
Not at all. And you are